Hello, I am Dr. Alexandra De Souza, Senior Lecturer in Psychology at Bath Spa University. Together with Dr. Scott Jones, also a Senior Lecturer in Psychology at Bath Spa University, I would like to welcome you to the 2020 through 2021 Brain and Behavior Seminar Series, hosted by our Center for Health and Cognition. We are delighted to welcome our first speaker, Dr. Jermaine Ravalier, who is Bath Spa University's Reader in Work and Wellbeing. Today, he will be giving not one but two talks addressing two different topics. The first talk is on why Black Lives Matter, and the second talk is on why do so many health and social care staff leave work sick, and what impact does this have on patients?
The pictures, no blacks, no dogs, no Irish. Difficulties with housing and employment and healthcare. You know, when my granddad first got here, he couldn't get a place to live despite having money in his pocket. He had to share a room with 5 other men. Couldn't get a job other than like standard kind of cleaning jobs, and there's nothing wrong with that. But you know, when you're coming to rebuild the country, that's not what you think of. Access to healthcare, to education, policing. My granddad once told me a story about how he was followed home from work by the police and abused outside of his home in front of his young children in the 60s and 70s. All of this kind of discriminated against the Windrush generation in less than 60 years ago. So within the lifetime of my parents, and in a city just 10, 15 minutes away from Bath, in Bristol, the Bristol bus boycott happened against discrimination in housing and employment. Black people couldn't be conductors on buses in Bristol, and they were backed by a Tory MP, which doesn't feel like it would happen now, and Bristol University students, and they led this bus boycott. And the reason that I highlight that is because people always think about or talk about what's happening in America, but the Bristol bus boycott happened 6, 7, 8 years after the boycott that Rosa Parks led. It happened after what happened in the States. Segregation had, in some ways, moved more in America by the 60s than it had here. And since then, there have been so many examples of where we protested against things. So you think about the Brixton riots in the 80s. My dad grew up not far from Brixton, and he remembers being chased down the street by National Front members. We have Stephen Lawrence on the right hand side in 91 in the Macpherson report about 25 years ago that found that there's systematic racism within the Met Police. In 2011, following the killing of Mark Duggan at the bottom, you remember the London, well, the UK wide riots in 2011, and just this year we had George Floyd, and it was. I've chosen that picture of George Floyd purposely because the one that we see in the media, where all you see is an angry black face with big lips and a big wide nose, is chosen specifically. George Floyd, although he'd done some illegal stuff, he was still a dad and he was still a husband, you know? And it's those injustices that we've just charted from the 50s all the way down to what happened earlier this year, that there's still a lot of that stuff happening now. So think about it from a more modern perspective. I've just got 3 examples here, but our very own beloved Boris. Boris referring to black Africans as pickaninnies with watermelon smiles. And, you know, he said things about the gay community and other communities as well. You've got the go home vans that were driven around as part of the hostile environment against not just the Windrush generation, but others as well. And then you've got just 2 weeks ago, President Trump refusing to shout down white supremacists in America. So even though there's a long history of black people being in the UK, you know, the first full skeleton found in the UK was found in Cheddar Gorge, just around the corner from here. It was a black guy with blue eyes and curly hair. But the more modern the more modern way of looking at black people has just been a history in the UK of consistent and systemic racism. So I've got a feeling that this video is not going to play. So on the left is a video, but I'll try it in a sec. So I'm going to now talk about just 6 areas, and I'm just going to talk about them briefly, and they're all going to be evidence-based because that's kind of what we do as psychologists, right? So first of all, I'm going to talk about policing and the justice system. So while there's so much focus on the US, I would argue that so many of our most treasured institutions are systemically biased against black people, and I'm going to show you how and why I say that. So this video, which again, yeah, it doesn't play, and I don't know why, but I could send it to you. So that video was a video taken about a week and a half ago in Gloucester, so about 8 miles away from where I live. And it shows a black guy who had stolen from, I think it was TK Maxx. His car got pulled over. He was compliant in getting out of the car. Policeman threw him to the floor, wrenched his arms behind his back to put on the cuffs. While the man was compliant with his arms floppy on the floor, literally not moving, the policeman took his knuckles and dug them into the man's eyes because of one of the pressure points. That's one of their pressure points. And the reason that I'm showing you this is for 2 reasons. So first of all, violent policing and aggressive policing is not something that is restrained to the United States. And second of all, because I'm the vice chair of a community group who work with the police to investigate situations like this in Gloucestershire. And so we had a meeting on Monday about what happened, and the police were adamant that there was absolutely nothing wrong in that video. And I wish I could show it to you, and I'd let you all make your own minds up. And I can email it around afterwards. But just to point out that, you know, violent policing is not something that is from the past, and it's something that happens in the UK as well. So over 20 years ago in the Macpherson report, babysitter's here, one sec. Oh yeah, there you go. Thank you. Happy days. Okay, over 20 years ago, with a Macpherson report, the Met Police was found to be systematically racist. And again, through the work that I've done with Gloucestershire Constabulary, Avon and Somerset Police, there are lots and lots of people and institutions who agree that actually not a lot's changed across a lot of the UK. So we know that, for example, there's lots and lots of violent policing. Black people are something like 25% more likely to be the victim of violent policing from in the UK. We know that with respect to fines due to COVID, black people are 3 times more likely to be fined. And I just wonder, what's that about? Like, why? Surely it's not, black people aren't kind of 3 times more likely to be doing stupid stuff with respect to COVID, because you just look at the beaches a few months ago, that weren't all black people, and there weren't a whole bunch of fines handed out then. Anyway, you look at stop and search, and stop and search is one that we hear about all the time, but I think the experience that young black people in particular go through is overlooked. So we know that black people are 9 times more likely to be stop and search. And imagine you're a young 15, 16-year-old boy, and I'm reflecting on this because this is a thing that happened to me and my friends quite a lot growing up in London. You're a young 15, 16-year-old boy, you're full of hormones and testosterone and stuff anyway. So you're always on edge. Now you get stopped and searched by the police once. Okay, that's cool. Like, we can accept that. You need to keep the streets safe. You get stopped and searched by the police once every month for a year and a half. You can imagine you're going to get a bit pissed off about that, right? And that is a real experience of so many young black people in certain parts of London. But despite being 9 times more likely to be stopped and searched, black people are only about 4 or 5% more likely to be arrested because of those stop and searches. Now, I would put it to you that imagine the same proportion of young white guys were stopped and searched in the UK. Arrest rates would be as high, if not higher. When we look at the justice system, we see that that is also biased against Black people. And the Lammy review is, I say, an interesting read. It's a long read, but it has so much interesting information in it. And the outcome of the review is that that is also biased against Black people. So you think about, we know that there are disproportionate numbers of Black people in prison. So Black people only make up about 3% of the population, but they make up 12% of the prison population and 20%, and this is probably most shocking to me, 20% of the youth justice population is young Black people. BAME, hate the phrase, but that's what they use within the review. BAME defendants are statistically more likely to plead not guilty on the word of their solicitor than white offenders are. And that's important because pleading guilty often leads to a non-custodial sentence. So that might be one of the reasons why there's such a high level of Black people in prison. You think of Black people are more likely to be sentenced to prison for drug crimes than white people are, for the exact same crime with the exact same backgrounds. And again, kind of coming back to it, it feels like, from what I'm going to say now, what I'm going to say in the next slide, that there is so much that is biased against young Black people that a certain proportion of young Black people are set up to fail from the very start of their lives. So, for example, for those young Black kids who are in youth offender services, they are less likely to be recorded as having like an underlying problem, so a learning difficulty or a mental health issue. So those needs go unmet from the start. But Black children are more likely to have their names added to the police national database than white children. So imagine there are 37 people in this talk. I reckon there are at least 2 or 3 of you within this group who have done stupid stuff as kids and you got caught by the police. So like nicking from Claire's, as one of my cousins did once, got caught by the police. Black children are more likely to get a criminal record because of that. And, that's fine. That's by the by. But again, it's setting them up to fail from the start because that criminal record follows you for the rest of your life. So if you think about, if you want to work in health or social care, if you've got a criminal record, it's out. Can't do it. It affects your jobs, your housing, your benefit entitlements. The likelihood of you going to prison for other minor offences in adulthood is all determined by this one thing that you did as a kid, that you are more likely to be placed on a police national register for because of the colour of your skin. Set up to fail from the start. Oops. So health and education, again, these are spoken about a lot less. But for me, they are probably more impactful because they impact such a wide variety of people. So for me, these are the 2 most important things. And we know that Black people suffer disproportionately from mental, physical, and childhood health outcomes. So think about the top left-hand picture on your screen is this COVID rash thing. Potentially part of the reason why Black people become more ill and die earlier is because of the lack of ability to recognize symptoms in yourself and in others. So this COVID rash thing here, so a proportion of people who develop COVID also develop a rash that goes along with it. And as the picture shows, as the article from The Guardian shows, out of 400 images that were used to depict what a COVID rash looks like, only 2 of them pictured non-white people or non-white skin colors. Now, if you're a Black person and you have a rash which may be related to COVID and you check that website, there's no way half the time that you're going to be able to tell if you're affected or not. And similar to what I was speaking to Pete about yesterday on the podcast, like you think about if you're low in oxygen, your lips go blue. Mine probably don't. If you think about jaundice, for example, skin goes yellow. Again, mine probably doesn't. Now, I appreciate that we need to cater for the majority of the people in this country. I think 84, 85, 86% of the people in the UK are white, which is cool, which is fine. But that doesn't mean we need to overlook everybody else. So Black people are 6 times more likely to be sectioned because of mental health difficulties. But I think the 2 health outcomes that stand out most to me are that this 3rd bullet point down from the top. So Black families, Black children have an infant mortality rate which is twice as high as white families. Like, as you know, I've got 2 kids and I can't imagine anything worse than my kid dying, and just having a skin color which is darker than everybody else's, and all of the societal issues that come along with that, leading to my child dying. Like, oh man, it hurts just thinking about it. But similarly, I'm looking at my screen and everybody on the screen in front of me, apart from Jerry, is female, and Black women are 5 times more likely to die during childbirth. Man, that just hurts. It just hurts to think about it. When we think about education, education is seen as one of the kind of pillars of our culture, right? We're meant to have one of the best higher education systems in particular in the world. But again, Black people are kind of systematically discriminated against even in education. So from a standing start, if you think about most kids at the end of primary school do their SAT. So we kind of know where they're sitting. We know their attainment by that point. Now, when you compare a group of white kids and a group of Black kids who got the same results on stats, white kids at the end of high school will have generally perform better than Black kids will have. So school attainment's affected. Higher education, like, we're not exempt. If anything, we're just as bad, right? So from a standing start, so you need a certain set of grades to get into university. So you know that kind of more or less everybody doing our psychology course or a biology course or whatever it is kind of has the same set of grades when they start. But again, Black kids are more likely to get a 2-2 and a third than white kids, and white kids are more likely to get firsts and 2 1s. I say kids, you know what I mean. Again, thinking back to setting up to fail from the start. So Black children are 3 times more likely to be expelled, and often for the same things that white kids do. Now, for me, that's a massive problem because expulsion has such high correlations with so many different adult outcomes. So being expelled is very closely related to going to prison as an adult. It's related to health outcomes. It's related to using drugs. It's related to all of these kind of bad things that we associate in adulthood. But I think it's also more likely for Black children, because they're more likely to be expelled, to be placed in care. And care outcomes are probably more, and I think this is a damning indictment of the care system in general, but care outcomes are probably more significant than school outcomes. And this is why. So Black kids are 10 times more likely to be placed in care. 10 times more likely. And as you know, I do lots and lots of work with social workers, and I did a podcast with a social work tutor a few months ago, and he kind of said to me that a lot of the time social workers just don't get those cultural differences between, for example, Black African, Black Caribbean families and white families. So at the meeting with the police on Monday, an example was given. So one of the a minister who is also on this group with us, he said an example of these cultural differences is if you walk past a Black barbers at the start of football season, all you're going to hear is noise and arguing, and just, it sounds aggressive and it looks aggressive, but all we're doing is chatting, man. But that happens in families as well. Like my grandparents, they're loud, they're in your face kind of people, but they are the nicest people in the world. But social workers and social care people just don't get it, like they don't get the culture. So Black children are 10 times more likely to be placed in care. And 25% of the adult prison system, 25% of people in that system have been in care. 12% of care leavers go on to university, just 12%, 1 in 10, compared to 1 in 2 of the general population, more or less. So Black kids are more likely to be stopped and searched and be given a criminal record. They're more likely to be placed in a youth offender service, where they're more likely to stay for a longer period of time. If they get to older childhood, they're twice as likely to die during infanthood, but they then do worse at school. They're more likely to be expelled. They're more likely to be placed in care, and therefore all of the adult things that come along with that. So for the Black people who make it into adulthood, this is where I'm going to call them racist. This is where racists say, look, you made it. You've done well. You've got a job. You've got a PhD. You're doing good stuff. But there is such clear systemic issues when it comes to work and the media and so many other places. So one example, just this year, it was reported that of the big 4 accountancy partners, so 4 of the biggest organizations in the country, 11 out of 3,000 of the senior partners were Black. I can't do percentages. I'd probably leave that up to Jerry, but what's that percent? 0 point something? I don't know. I'm looking at Jerry's on my screen. He doesn't know either. But there is some kind of classic social / organizational research studies as well that have shown that, for example, the GEM project, which is led by researchers in Oxford University, they showed that non-white, so what they did is they sent a whole bunch of job applications that were similar in every single way, apart from, in this case, the ethnicity of the person applying. And they sent, I think, in the GEM project, they sent over 3,000 applications. So everything was the same apart from the ethnicity. And they found that ethnic minorities had to send 60% more applicants to receive the same number of interview callbacks as the white applicants were. And, we hear about people from kind of African and a lot of the time from Asian backgrounds changing their names, because just by having a name such as Jamal or Jermaine, you're less likely to get a job interview. So a classic kind of social industrial organizational study showed that white sounding names such as Greg and Jennifer were 50% more likely to receive an interview callback when everything else was the same, when compared to like a typically Black name, whatever that means, whatever typically black names. And again, academia is not exempt in any way, shape, or form. We've looked at the impact on students, but it's the same for the academics, right? So there was a post on Twitter which came from whatever the higher education stats people are called, and they highlighted that there is a maximum of between 3 and 5, depending on how you round up the percentage points, Black people in senior positions in all of academia. So of the 126, I want to say, universities, there are like 5 people who are kind of up there. And interestingly enough, it's those 5 people that racists say, look, you can do it. It's a meritocracy. If you're good enough, you'll get there. It's not how it works, right? And there are almost as many universities as there are Black professors. So I think that, again, if there are 126 universities, there's like 135 Black professors in this country. I mean, we were lucky enough to appoint the first Black professor of history, right? And then she left. But the media is just as bad. Just think about how Meghan and Kate were treated by the very same papers, right? So you think about Kate on the left-hand side, she had avocado because it will cure her morning sickness, whereas Meghan had her love of avocados related to human rights abuses. When Harry first started going out with Meghan, there was a Daily Mail headline which said, straight out of Compton Compton is California, right? Where you think straight out of Compton, you think Dr. Dre, you think F the police, you think all of those kind of negative things. She grew up, I think, 15, 20 miles away from there. The racism is clear. Think about Phil Foden versus so that's not Raheem Sterling, but think about Phil Foden versus Raheem Sterling. So Raheem bought his mum a £2 million house after like a £40 million transfer from Liverpool to Man City, and it was him showing off. He's showing off his wealth. Phil Foden hadn't started a single game for the first team of Man City, did the same for his mum, and he was a starlet who was doing the good things for his parents. So we've seen policing in the judiciary, we've seen health and education, we've seen work in the media. But to conclude, these are just 6 areas in which systemic racism is inherent in the UK. And, you know, these aren't silly little individual cases. These are national level statistics. There are so many other examples. Think about sports. Why are there no kind of high profile black football managers? Why does Steven Gerrard and Frank Lampard get their first job in like a really high profile club, whereas Sol Campbell and Ashley Cole are down League One, League Two? Think about politics. Diane Abbott, who I look at her almost as a god. She's fantastic. She's brilliant. But can you remember the shit she got for drinking a can of mojito on the train? Whereas like half the Tory cabinet can piss off to see their parents when they've got COVID and it's fine. The last example is local politics. So I'm getting a bit involved in local politics, and Cheltenham Borough Council was all white, 100% white. At the start of the Black Lives Matter campaign, they were talking about, I raised a motion and all this kind of stuff, and they were talking about the Black Lives Matter stuff. And one of the senior councillors decided it was a good idea to drop the N-bomb repeatedly in a public meeting and didn't see the problem with it. So where I'll conclude is every life is really important. And I think by improving the prospects of Black people, it will improve the prospects of working class people, of traveller people, of every other kind of systemically oppressed person in this country. But at the moment, it's Black lives which are disproportionately affected by every one of those things that we've just highlighted. And that, for me, is why Black Lives Matter. And then there's a bunch of references. Okay, I appreciate I have been a solid 30 minutes. So I'm going to whiz through this. I wouldn't be able to do it as well as Elaine, and she's in the corner and she's great. So like she's intimidating me a little bit by looking, but that's cool.
Shall I turn my video off? But thank you so much for that.
No, don't worry. So health and social care. So this is my research area, right? So what I was just talking about before was what I'm interested in, whereas this is my research area. Not that I'm not interested in, I'm just less interested, I guess. And actually, we're going to look at sickness and wellness, in particular, trying to put it into context of COVID-19. So why is mental health and why are working conditions so important? We know that if you have crap working conditions, for example, if you have a workload which is huge, or you have really poor support from your colleagues or your managers, it will lead to ill physical and mental health, right? And the Stevenson Pharma report 3 years ago said that we are facing a significant mental health challenge at work, and that was before COVID. We know that tens of thousands of workers give up work every year because of stress and mental health, and 2 million people blame work for their ill physical health. And that's not surprising, right? So Rosengren did a really interesting study where they looked at, I think, 100,000 participants, and they found that those with higher levels of stress at work also had higher levels of cardiovascular disease. And they did lots of fancy stats that I'm not going to pretend to understand, but they demonstrated that. But we also know that chronic stress rather than acute stress. So acute stresses are like if you're a policeman and you're chasing after someone, that's really acute stress. Whereas chronic stress is that stuff that just happens day in, day out, every day over a long period of time. And chronic stress affects our physical health. In particular, one example is that chronic stress affects our immune response. So the example that I always give is after like a really stressful month, for example, at work, which I think we probably all had, how many of us have then suddenly developed like a cold or the flu? Our immune system has been depressed because of homeostatic stuff. I won't go into the biology of it. It affects our subjective health. So if you've had a really shit day at work, or you know you've got a shit day coming up, how bad is your insomnia, like your inability to sleep? Imagine you're stressed all the time. You're kind of tense. You're always tense. Your muscles are tense. Your mind is tense. And so it leads to Elaine's area of expertise in the musculoskeletal pain, but also behavioral manifestations. And this is kind of one of my favorite ones, but maybe one of the most destructive. So how often have we had a really shit week day? I'll just go through a day. Let's say Monday has been really crap. How often do we go home and have like a glass of wine, a couple of glasses, maybe a bottle? That if that happens too much, it's really, really bad for your health, as you can imagine. So it has an impact on our physical health, our mental health, our subjective health, and our behavioral health. Now, as much as that's impactful on the individual, it's as impactful on the organization that you work for. So for example, in the NHS, 30% of sickness absence is due to stress at work. So 3 in 10 people who go off due to work, who go off work with sickness absence in the NHS is due to stress, and it costs well over £600 million a year. And the reason why that's so important, so like I kind of care about the workers, that they're really important. I care less about the organization, but I care most about the people that they work with or they work for. And that's the patients, right? So we know that mental health and stress is really closely related to morbidity outcomes in patients. So the higher, so for example, Weston Dawson of the King's Fund, they did a really interesting study where they looked at NHS, the NHS staff survey over a period of years. And they found that NHS trusts with the highest levels of stress and sickness absence and the poorest levels of mental health, patients also had higher levels of morbidity, so developing life-limiting illnesses and mortality. So they died earlier than they would have. So sickness absence in the NHS affects not just the individual worker and the NHS organisation, but it also affects the people that those workers are trying to improve the lives of and improve the health of. And it's no different in social care. So my kind of big thing with social care only really started about 5 or 6 years ago when my wife started, then girlfriend, started training as a social worker. She's a social worker now, she's at work. And social care gets spoken about a lot less frequently, but it's as affected, if not more affected, by this stuff. So in social care, stress and depression led to well over 2 million working days lost in 2014-15. They're the latest figures I can find, but it's even worse now than it was then. And in social care, stress, sickness, absence has gone up 20%. And I think the one thing that really highlights the issue with social care is that, think about Victoria Climbié, think about Baby P, think about those serious case reviews that we've seen made into documentaries, you've seen it in the news. Most of the serious case reviews find that negligence on the case of social workers is almost purely because they are so overworked. They are so overworked. And I'll tell you a bit more about that in a minute. So having high levels of mental health and stress at work is therefore related to mistakes. And it's also related to suicide risk in the worker. And, you know, in 2020, at the start of the pandemic, when we'd just been locked down, the Department for Health and Social Care said, right, there's little to no support, mental health support for NHS and in particular social care workers. So what did? They released an app. And what did the app do? The app gave them money off vouchers. Fantastic. That's what you want in the middle of a pandemic, right? So health and social care workers, as I've already said, are key, as we all know, actually, are key to the UK's COVID response. The WHO said that specifically. The Department of Health and Social Care said that specifically. But we know the issues that have been associated with working in health and social care over the last 7 or 8 months. Lack of PPE. So at the start, I say at the start, it's kind of still a bit crap now, but particularly at the start of the pandemic, my wife would go out on visits to, and they were only allowed to go out on visits to the most vulnerable people. She would go out on visits, and because there was no PPE, there was no personal protective equipment, she would be going out with a mask and some just standard kind of woolly gloves on as her PPE. That's all we had. As I said, there's and you know, that's social care. The NHS was so much worse, and care homes as well. Man, how bad did they have it? Have they still got it? The lack of mental health support, as I said, before the pandemic, there was a little bit for the NHS, nothing for social care. Absolutely no mental health, no kind of centrally provided mental health support for social care. At the start of the pandemic, before they released the app, they released a text messaging service. Yeah, this is text me if you feel stressed and we'll give you some advice. Go do some mindfulness, yoga, go for a walk. That will help. That will definitely stop you from becoming ill because you're working too hard. And then they released the app. What did the app do? They put this text messages service into an app. Yes, and you can get 20% off at Pizza Express. Maybe you'll see Prince Andrew there. And lack of staff numbers as well, right? So we had to recruit tens of thousands of retired doctors and nurses. Nurses and doctors' training was cut short without any reimbursement. You wouldn't expect any more, I suppose. But social care had no extra work, had very few extra employees. Social work still has tens of thousands of unfilled places. Nursing still has, I think at the last count was like over 25,000 vacancies for nursing. And then care homes, like the thing with care homes is it's such an amazing job for the people that do it. They love the job that they do, but I would never reference Pizzagate. They love the job that they do, but they get paid minimum wage, man. They get paid minimum wage. And when you're a domiciliary care worker, so if you are traveling from one very vulnerable person's house, let's say you've got you'll be lucky if you get an hour-long visit with a very, very vulnerable person at the start. Finish at 10, you'll then have maybe an hour gap to drive to the next person. You don't get paid for that hour gap. So you drive to the first person, you don't get paid for the gap. You drive to the second person, you don't get paid petrol and stuff. You get to the second person, but you haven't managed to change like PPE. You haven't managed to change your clothes. You haven't managed to do any of those things. Now, I'm lucky enough to be an editor on a journal called Occupational Medicine. And it's the only journal that has had a focus on occupationally acquired COVID infections and deaths. And Agius, Professor Raymond Agius, I think he's from Manchester, or I think he's emeritus professor now. In his paper, he found that from HSC and coroner reports that there were 9,000 occupationally acquired COVID infections across the last 6 months or so, and 125 deaths from occupationally acquired COVID-19. So this doesn't account for all of the people who had caught it outside of the workplace and got ill. This is just people who, you know, kind of like a bit like lecturers who are teaching in person, right? These are just people who had acquired it at work. But this is also an underestimation. So, for example, COVID infections are generally investigated by the health and safety executive, whereas deaths are investigated by the coroner. The coroner has a lot less experience and kind of not quite as good as the HSC at doing these things. So actually the number of deaths is definitely going to be an underestimation because coroners aren't as experienced as doing that. So what I'm going to tell you about is a couple of projects very briefly because we're running out of time anyway. And what I managed to do is I was lucky enough to get to run a couple of projects with some fantastic colleagues. So the How NHS project and the How social work project. How stands for healthier outcomes at work, and the idea was to develop a series of mental health and well-being interventions for health and social care workers in a number of organisations. And I was lucky enough. Weren't they reporting COVID deaths? Oh, I missed it. I'll have a look at the message in a sec. Sorry, I missed it. Lucky enough to work with some excellent people. So everybody that knows Elaine knows that she is the best academic I've ever met, and so she needs the props that come her way. Mark Loon did less, and I'm sure he will happily admit to that. But we also worked with colleagues from Exeter, Anglia Ruskin, and Westminster, and the idea was to develop a set of interventions which could support positive well-being and mental health at work. So we worked with 4 NHS trusts in one of my projects, and annoyingly / not quite it's not too surprising, but those 4 trusts then merged together into 2 super trusts. And what happens when you merge together in super trust? You have cost savings. What happens when you have cost savings? You have one person doing the job that 2 people used to do, so extra stress, right? And then originally 7 local authorities that employ social workers, but now but towards the end we only worked with 5. And the idea was that we spoke to and listened to the experiences of staff, health and social work staff, in order to design a series of interventions that could be applied through a toolkit or through an app, because nobody knows what an individual needs to support their well-being at work better than that individual themselves. So rather than us coming in as experts thinking, right, we know what we're going to do, we know what needs to be done in order to support mental health, we said, right, let's talk to these people and hear what they want. The interventions needed to be general enough that they could be kind of cover all of the organizations that we're working with, but actually we could also tailor them to the situation in each. And as I said, not interestingly, all 4 NHS organisations went through a merger. So we started off with a massive staff survey, looked at working conditions, all the things that I've just been talking about, well-being, mental health. And then we did a lot of interviews. Across the 2 projects, I think pre and post, there were probably 80 or 90 individual interviews. Luckily, I had other people to do those things, particularly our fantastic postdocs, Ollie and Charlotte did a lot of it, and Paula did quite a lot as well. And the idea is that we worked with clinical and non-clinical people within health, within the NHS services, as well as social workers. And what we wanted to do is understand the stresses that they were under, as well as how to improve on those things. And generally it was high workload, lack of support from peers and management. And in particular, one thing that stood out was the number of hours that social workers were working. So healthcare workers, we know, work a lot of hours. I think on average it was about 6.5 to 7 hours a week more than they're contracted to. So that's like an extra day, right? Social workers, wow, they worked on average nearly 12 hours a week more than they were contracted to. So that's like working Monday to Friday, Saturday, and half a Sunday every week. And a bit like academics, they would never take their time off. They would never take all of their leave, because if as a social worker you take your leave and a child dies, you never get over that guilt. So yeah, huge levels of workload. We then did some focus groups to better understand the interventions and looked to disseminate the toolkit and developed it into a toolkit and an app. And these are the interventions that we came up with. And the first is psychoeducational. So it's like, this is what stress looks like. This is what poor mental health looks like. And this is what the organization have that can support you. we set up a whole series of peer support groups, particularly in social work, because peer support is such an important buffer towards negative mental health. We advise them on setting up champions for things like well-being and communication, and also these things called freedom to speak up champions. They're used in the NHS a lot. They're like, if you see a bad piece of clinical work, you can anonymously kind of grass on them a bit, and that is a thing that we implemented into social work. We developed a new model of reflective supervision in social work, and as well as ensuring that clinical supervision happened more frequently, some more psychoeducational stuff about healthy living and healthy work. And then Elaine had a brilliant idea about developing or employing a trained occupational therapist to work with us with the social workers. And the aim of this occupational therapist was a person could self-refer them through the app that we developed, self-refer themselves through the app that we developed. And the occupational therapist would work with the individual who had self-referred, as well as the individual's manager and like HR, occupational health, because what we want to do is keep people at work and make that work as good for them as possible. Because as people will tell you, being unhealthy at work, being off work is usually worse for you than it is being at work, particularly if you've got good work. So if we could keep people at work, even for a short period of time, even if it was for 4 days a week rather than 5, even if it meant a reallocation of cases, even if it meant doing a different clinical piece of clinical work, keeping people at work is so much better than people going off work with sickness absence. So what did we find? Working conditions for social workers, as we found in 2018, were significantly worse than any other group I'd ever seen. So I've done this work with lots of public sector organizations, with social workers, NHS staff, teachers, care workers, and private sector workers. And social workers scored on average for their working conditions worse than 90% of the rest of the UK average. Like, they were in the bottom 10% for almost everything. So we are just going through the stats. We had a meeting about it yesterday. We have our resident statistician from Westminster who is doing the numbers, because I don't think anybody else understands them. I certainly don't. But we found kind of what we would expect. So communication, in particular change communication, had significantly improved over the projects, despite the second set of data being collected during COVID, like during lockdown. And managerial support was improved as well, again, despite the second set of data being collected during COVID. Otherwise, there were no significant differences. That nothing was better, nothing was worse. We didn't see a significant improvement in psychological well-being, but I think you kind of understand that because, like, we just entered a pandemic. Things aren't really going to get that much better. So yeah, those preliminary stats kind of showed that we had some impacts, but not as wide as we think we might have done otherwise. I just want to share one story with you before I kind of talk about some of the final little bits. When I think it was either me or Elaine, I can't remember, one of us were interviewing a social worker, and this is the impact that the workplace has on you. So their social work, the local authority had been assessed by Ofsted as kind of being the worst of the worst. You know, it was whatever, failing or whatever it is at the very bottom. And so what happened is a whole big restructure, and middle managers, which this particular person was placed into senior management roles. Now, he worked 6 a.m. to 11 or 12 o'clock p.m. every single day, Monday to Sunday. After 6 months of it, the weight of the pressure coming from the top down, the weight of the pressure of his own caseload, and the weight of the pressure from the people that he worked with meant that he felt he couldn't cope anymore. And it was so severe that he tried to take his own life more than once. This is and the only reason I'm telling you that is this is why I do this work, is because I want to try and support people and stop them from becoming too ill at work, because it's just people should never ever ever feel like they need to take their life because of a job. It's just a job. I know it's a very important job and they're working with the most vulnerable people in the country, but it's just a job. So what have we done? We've done loads of media stuff highlighting what we've been doing. We've done lots of stuff in Parliament. So, for example, there was a debate in the House of Lords. We've done loads of kind of policy briefings, which are the most boring things I've ever done in my life. I'm never going to do any more again. I'm going to get other people to do them. We had a launch event in the House of Parliament, given written and verbal evidence to the Health and Communities Local Government Committee Inquiry. I'm trying to remember what that stood for. And I've also released a national social work wellbeing toolkit, which has been used during COVID by 15 separate local authorities. So overall, health and social care workers, they love their actual job. The job that they do in making an improvement in people's lives is what they do the job for. It's not because they're paid well, because effectively they're not. However, too much is expected with too few resources, and underfunding means that increased demands and subsequently working while ill, so presenteeism, means people want to leave their job. And a lot of this we found before COVID. COVID has added a new layer of difficulty with respect to their working conditions. So our projects might have contributed to improving managerial support and communication improvements, but really we need more money, right, Elaine? We need another $500,000 to just to make sure. So thank you. That's me. That was a quick hour. That was real quick. I thought I saw a couple of messages in the chat. So Gemma, weren't they reporting COVID deaths from car accidents, which completely messed up the data? I think there was probably some misreporting of the data, but that's the whole coroners versus the HSC thing, right? The HSC look purely at the workplace acquired stuff.
Jermaine, can I ask a question about mental health care around the NHS and social care workers?
Yeah.
I happen to know that there was actually a ton of effort put into that when they were developing the Nightingale in London. And in fact, somebody's making a career off of it right now with tons of media and all that. And I find it really interesting that, of course, that was totally mobilized for such a high profile project. But in fact, actually, systemically, there's no foundation for it. And to be fair, I didn't know that. So I find that surprising. And I'm just wondering if you can reflect on that beyond the obvious cynicism of we're going to put it in our flagship thing. But I just was unaware.
Yeah, no, there's nothing like, so we did a review. So we put in a obviously unsuccessful ESRC bid a few months ago. And we did a review of what was available for health and social care. And generally, so when you think about mental health at work in particular, the best thing you can do is make changes to the source of the problem. So you can improve on the organization, right? That's the best way to improve mental health. You can improve coping in individuals and you can improve coping in teams, which is all good. But the best thing you can do is improve on the workplace. The only thing that we found that had actually been made available was that texting app. So at the start, text me or text these people and they'll give you some advice on, as I said, like going for a walk or breathing properly or something, get a bit more sleep. And then they released the care app for social care, which was quite literally, again, here's what you can do to kind of reduce, to cope better. It's not to reduce stress, it's to cope better, which is a different thing. I think the problem with coping is it places all of the blame on the individual and it takes all of the blame away from the organization. And then like, here's 20% off at Argos and stuff. That's kind of it. There's nothing, there's a lot of other stuff. I think there's other stuff being developed through like King's College and UCL and those kind of places, but I don't think there's anything else that's kind of national. Avril, can you can you catch up on the first part? I don't know, man. We got like 2 minutes, so probably not. But it's been recorded, so you can watch it again afterwards. Cool. Okay. Any other points, or do we all go and get coffee before our 11 o'clock meetings, whatever they are?
Can I ask one quick question?
Of course you can.
Thanks for 2 great talks. I appreciate that you've kind of done them separately, but I did want to just ask, I wondered if you found in the How project anything that kind of links to that Black Lives Matter thing that you were first talking about, because it kind of seems like all of those things that you addressed there would be so relevant to that project, you know, like the health problems and how microaggressions and those kinds of things might come out in exacerbating those problems.
Yeah, it's not a thing that we in any way asked about, particularly because most of the stuff that happened, the kind of original set of data collection, the pre-data collection, was done in 2018. So it was kind of before any of the big BLM stuff happened. I have done some national surveys of social workers, and I asked about the experience of non-white social workers. And about 65% of non-white social workers said they'd experienced some form of racism at work, not from service users, but at work from their colleagues or their managers. And about 40% of them said that they had been actively denied a promotion because they felt of racism. So we haven't, and I haven't, kind of looked to develop any of these things into supporting a particular group. I would be uncomfortable with doing that, because I think I would be uncomfortable with that level of segregation. I think we can support and help so many groups by focusing on one. So yeah, that doesn't really answer your question, other than no, we didn't really do that kind of thing, just because it was a while ago. And then the second set of data collection, yeah, like the world had stopped by that point, and we were struggling anyway.
Thank you. Yeah, I think the situation with social workers is absolutely dire. As you say, let's just help them all. But yeah, I was just interested to see if you'd picked anything up.
Yeah, no.
Thanks.
Cool, thanks. Okay, everybody, we are 11 o'clock on the dot. Quick question in relation to stress experienced by social workers. Did you find that people who have been in their career for a longer time experience more stress, likely to build up? So social work is weird, Sean. It's a weird, no worries, Pete, even though I saw you disappear. Social work is a weird occupation, because people either tend to stay for a short period of time, so a few years, or a really long period of time, so lots of years, which means the average balances that out. I think the average length of time people have been in social work is about 8 or 9 years. So actually, a lot of people leave really early because of the stress that they feel. So especially after their first assessed year, a lot of people then leave. But then the people who do stick with it tend to stick with it for a huge amount of time, like 25, 30 years. So I don't think we did the stats. I say that. I can't do the stats. I don't think anybody did the stats on the difference between length of experience. But from speaking to the people who kind of run social work in the country, I don't think that's a difference. Yeah, Rosie, there's a cool. Yeah, that sounds really interesting. I'll check that out. Everybody look at Rosie's podcast. That'd be really cool. Okay, guys, thank you very much. I'm gonna head off and get coffee, and yeah, then I've got another meeting in 13 minutes. So thank you, everybody.
Thank you, everyone, for joining. I hope to see you at future brain and behavior seminars.
Definitely.
Bye. Thank you, Jermaine. Bye.